The city is calling it a milestone. Chicago is beginning COVID-19 vaccinations outside the setting of city hospitals. Dr. Jennifer Ashton, Chief Medical Correspondent for ABC News, is with us live. Doctor, as always, it's good to see you. Nursing home residents and non-hospital healthcare workers are among those now getting vaccinated. How soon could those vaccinations, you think, impact daily COVID numbers that we're seeing?
Well, I asked Dr. Anthony Fauci about that. We're calling it the vaccination metric. So when will we be able to see a positive effect of our vaccination campaign? He doesn't think it would be before the end of the spring, basically 4 to 5 months from now. But I have to tell you, our rollout is not going according to the pace that we need it to go by. Just in 2 weeks, we've seen about 2 million Americans vaccinated. If you continue that rate, we're going to be in a lot of trouble. We need to ramp up the pace and get these vaccines to as many people as quickly as possible.
Yeah, a lot of work to be done here still. We're seeing a relatively low count of COVID-19 cases in Illinois, but for weeks the number of people dying has been high. But what do you think is behind that, Doctor?
Well, I think it's a combination of things. First of all, we have to remember we're a huge country, and so we have a patchwork of different hotspots. And absolutely, we talked about it just today on GMA3. The success seen in the state of Illinois is absolutely where we should be going as a country. But when you look at death rates, the clinical care of these most severely and critically ill patients with COVID-19 absolutely has gotten better, but it is still killing way too many people every single day. So I think that we have to balance, and not rest on our laurels. But for sure, what has been going on in the state of Illinois is what more states in the country need to do. And that's going to involve a combination of factors, the vaccine being one, but those social mitigation, mask wearing, also very, very important now more than ever when hospitals are really at or near their capacity and breaking point.
You mentioned young people. For those who vape or use e-cigarettes, are they at higher risk of infection and complications later on?
So, vaping and e-cig use, remember, was a front page story right before COVID-19 hit the news, and it hasn't gone away. There's a limited amount of data in the medical literature about those two groups. But yes, it does appear that the chronic exposure of a lot of those chemicals contained in e-cigs can make someone with COVID-19 more sick, more vulnerable. But the real issue is that the presenting signs and symptoms of vaping-related lung injury can mimic that of COVID-19. So again, this is common sense here, you guys. You don't want to do anything to your lungs that could predispose you or make you more vulnerable for a high-impact respiratory pathogen like SARS-CoV-2.
Got it. Dr. Jennifer Ashton, good to see you and appreciate the guidance. Thank you so much.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.